Hello, my name is Dr. Cohen, and I'm here to share with you top 10 list of tips for taking care of a 3-year-old. Tip number 1, make sure to get immunizations. By age 3, your child should have received multiple vaccinations, should be in the middle of a series of certain vaccines, and should have completed others. Also, at age 3, a child should get the influenza vaccine during the flu season. So check with your health care provider to make sure you get the influenza vaccine and to make sure you're up to date with all of your immunizations. Tip number 2, ask your health care provider to screen your child. There are many things besides giving vaccines that should be screened for at age 3. Your child's height, weight, and a calculation of their body mass index, your child's blood pressure, and a screening for vision. There are certain other tests that can be screened for if there's a concern for these things. For instance, hearing should be screened for if you as a parent or if your healthcare provider has a concern for your child's hearing. Anemia should be screened for if your child has special health needs, is on a low iron diet, such as a vegetarian diet, or is in poverty. Another screening test is for lead. Lead should be screened for if you live in a house that was built before 1978, or if your child has a sibling or a playmate who has had lead poisoning. Tuberculosis is yet another test that could be screened for when there are certain reasons to be suspicious. For instance, if your child has had close contact with someone with tuberculosis, if your child was born in a country or traveled to a country and stayed there for over a week that is other than the US, Canada, Australia, New Zealand, or Western Europe. Any of the countries, any other country that I didn't mention, if your child was born there or spent more than a week there, then it's reasonable to screen for tuberculosis. Tip number 3, promote literacy with your child. Help your child learn how to read. You can encourage literacy with reading, singing, and playing rhyme games. You can talk about pictures in books. You don't always have to just read the book. And let the child tell the story. Let your doctor know if you have concerns about your child's literacy. At age 3, your child should be understandable about 75% of the time. She should know her name, identify herself as a boy or a girl, know the name of a friend, know the name of a cup, a ball, a spoon, and a crayon, and should be able to tell you what he can do with these things. And should be able to follow 2-step instructions, such as pick up your doll and put it on the chair. Tip number 4 is to promote physical activity. Exercise together as a family, or make sure that daily physical activity is part of your child's care, part of your child's care, and whether your child is being cared for by you or by somebody else. Also, limit television to between 1 and 2 hours a day at the most, and make sure you don't have a television in your child's bedroom. Tip number 5, ask your doctor if you're concerned about your child's physical development. By age 3, your child should be able to feed and dress herself, build a tower of 6 to 8 cubes, throw a ball overhead, walk upstairs alternating feet, copy a circle, draw a person with 2 body parts, like the head and one other part, ride a tricycle, balance on 1 foot for 1 second, and begin to use the toilet during the day instead of the diaper. If you have concerns about your child's development, not being able to do any of these things, let your healthcare provider know. Tip number 6, dental care. Make sure your child is seeing a dentist twice a year for routine screenings. Tip number 7, car safety. Don't let your kids play alone in the street where they could be hit by a car. At age 3, children have a desire to explore, but they lack the judgment to prevent getting into dangerous situations. Also, when riding in a car, make sure to use a forward-facing car seat and have it properly installed in the back seat. Tip number 8, install window guards. It's important to install window guards on all windows on the second floor or higher. And tip number 9, play dates. If your child is not in childcare or preschool, make sure she has opportunities to play with other children by arranging play dates. Encourage interactive activities with peers and help her understand the importance of taking turns. And tip number 10, believe in yourself. With the help of your healthcare provider and with these tips, you absolutely have the tools to make a great parent and have a great relationship with your 3-year-old. Thank you very much.